Welcome and thank you for joining us today. We are so excited to present United Way of Greater Greensboro's first ever mid-year outcome public update. We are extremely grateful for your support and can't wait to share with you our investments that we have accomplished over the last 6 months. But before we share our collective outcomes, we want to give you a quick business update and share an overview of our strategy to end local poverty. My name is Nadine Malpass, and I currently serve as United Way's interim CEO. If you've not heard, Kari Garvin, our immediate past president, last day with United Way was March 3rd. Kari answered a call from the White House and accepted a once-in-a-lifetime opportunity to become the National Director of Head Start, a program that provides early educational opportunities to low-income children. Kari led the regional Head Start program before he started with United Way, and this political appointment gives him the opportunity to continue his passion of working with anti-poverty programs on a national level within the U.S. Department of Health and Human Services. We are excited for Kari, but I'm here to tell you that United Way is still in very good hands while our board conducts a national search for our next CEO. Rest assured, the staff here at United Way will not skip a beat, and we will continue to create, connect, and lead community partners that equip and empower people to leave poverty. I personally have served as United Way's Chief Development Officer for the past 7 years, and speaking from experience, I can tell you that between the leadership of our board, our innovative senior leadership team, and our gifted staff, we will continue our strategic work to end local poverty. And speaking of strategy, I'd like to hand it over to Tracy McLemore, our Chief Community Impact Officer, who will give us an overview of the community-wide strategic efforts. I think after hearing from Tracy, you will have a clear understanding of what exactly United Way does in our community.
Thank you, Nadine, and thank you to everyone who has joined us today. As you just heard, I'm going to walk us through a brief overview of our strategy. We feel that it is very important to explain what we do and how we do it before sharing our mid-year outcomes, because we want you to fully understand the impact that you're making possible. We also want to hear from you during today's event. So if you have a question, please submit it in the chat, and we'll do our best to answer it during our open Q&A time today. I believe we do a great job with our messaging and sharing our work, but meetings like these give us a chance to share things on a personal level. You may be aware that United Way creates, connects, and leads community partnerships that equip and empower people to leave poverty. But we want to share a little more about what that means. Specifically, our strategy builds pathways out of poverty by helping youth transition from cradle to career, helping adults land jobs and increase incomes, and provide access to basic needs in healthcare. We additionally leverage the great work of our nationally recognized family success centers and our innovative Guilford Success Network to bundle services and eliminate barriers. As you can see, our framework, all of the approaches fit into 2 areas of our framework: poverty ending and poverty relieving, and systems change, which we will have strategies identified in FY 2024. Our strategic partners, and then I want to share every year, local nonprofits apply to join our strategy and end local poverty. Every year, local volunteers select the best of the best partner programs that align with our strategies to receive the grant funding. Last year, we created 31 strategic partnerships and initiatives that are supporting 61 programs across the entire community. Our 2023 strategic partners received grant funds that provided services to help people find ways to stay on pathways out of poverty through cradle to career supports and services for basic needs, access to healthcare, and financial stability, or offer clear ways for people to leave poverty by increasing and maintaining their annual household income above the federal poverty threshold. Our impact areas for strategic partners are cradle to career, where we ensure children and youth hit major milestones from the time they are born until they find a career on the path to leaving generational poverty. We want children ready for school and reading on grade level by 8. And we want children and youth ready for school and ready for success in school, work, and life. So we invest in early care and education, health and development, and literacy efforts for children and caregivers. We invest in academic support in college and career readiness for children and youth. Unemployment and financial stability. We are helping adults get on the path and move over the poverty line through employment, educational attainment, safeguarding income, and asset building. We want adults to gain employment and increase income so that the household moves out of poverty. We also want households to maintain their progress by safeguarding income and growing assets for financial stability. So we invest in employment, educational attainment, growing assets, reducing costs, and obtaining benefits. Also, child care scholarships so that children are in high quality early care while adults work and attend schools. In health and basic needs, we're addressing households' foundational needs to keep them on the path out of poverty. We invest in housing to help people, adequate, safe, and affordable housing or shelter, provide personal safety, and gain access to physical and behavioral health care, including healthy food. Some of our initiatives and integrated service delivery efforts are additionally what we do and lead and fund successful community-wide initiatives. Our early childhood initiative, Thriving at 3, focuses on preparing kids to be successful when they enter school and includes our early literacy programming, Raising a Reader, which helps families develop, practice, and maintain shared reading routines critical for early learning success. In addition, Mentoring Matters focuses on pairing a caring adult with youth to provide coaching and support. Our AAMI, African American Male Initiative, focuses on creating mentor-mentee relationships for local African American and Hispanic Latino youth. This program serves youth and follows youth at Wiley Elementary, Jackson Middle, on through to Smith High Schools. In our integrated service delivery approach, our ISD or integrated service delivery approach bundles and sequences services to meet an individual's needs. ISD is a research-based and proven strategy to equip and empower people to leave poverty. ISD programs are our FSC, Family Success Centers, and the Guilford Success Network, which you will hear about a little later. All of this leads to our outcomes. All United Way funded partners and initiatives are required to report and produce outcomes. United Way has recently committed to providing our community with outcome updates twice a year. And today marks the first time we are providing our mid-year outcomes publicly. At this time, I'd like to hand it over to Carrie Jones-Barrow, who serves as our Senior Director of Strategic Partnerships, who will provide you with an exciting mid-year update. Carrie?
Hey, thank you, Tracy. It's great to see everyone today. I appreciate it. The first thing when we talk about sharing outcomes is, what is an outcome? United Way, when we evaluate investments at both the application stage and throughout the life of the grant, we want to know that our investments are making an impact, that we are achieving the goals that Tracy outlined, and that those folks who are participating in the services that we are funding are better off. So we, as Tracy mentioned, we do asset programs track outcomes, but what is that exactly? So let's define two concepts that often get confused: an output and an outcome. An output is what a program does. If I said, what does your program do? And you said, this is what we do. These are the services we provide. These are the numbers of people that participate. These are our activities. This is how frequently we do them. There's things that you can count. But the more important question that we're interested in at United Way is the impact of what you do, answering the so what question. We're looking for a change in knowledge, skill, condition, status, or behavior. And we want these changes to be measurable. So we ask that everyone who applies for funding, and it is funded, provide specific measurable outcomes that support the goals we have, and that these indicators are actually required. And we have specific data points that we want programs to provide updates about. So for example, if we have an after-school program that we're funding, the after-school program's outputs are, we have this many children attend after school, this many people receive tutoring for this many hours, but we want to know that these children are better off academically. So this is indicated by the children's grades or their reading scores. And so the programs provide updates to us about those indicators. Similarly, with a financial literacy program, for example, the outcome we want is that adults are better off managing their finances. And so a financial literacy program has certain outputs. They do workshops, they have one-on-one counseling. They're serving a particular set of people who may have debt or budgeting challenges. So how do we know that folks are better off for having participated in this program? It will be indicated by reduced debt and an improved credit score. That is the outcome. Those are the indicators that programs provide data for. How do we at United Way get the data? We get it by progress reporting. So every program we fund, first of all, sets projections for the life of the grant. They tell us what they will measure and how they will track it. Then every quarter, every 3 months, they provide us an update. And these reports include both quantitative and qualitative information. Quantitative information would be all the counts, would be the report on the indicators, the demographic data of who is served. But they also provide us what we call the story behind the numbers. We always give our programs an opportunity to answer narrative questions where they tell us about challenges, successes, changes to program operations. So we get numbers and we get information to help us understand the numbers that are provided to us. All information provided to United Way is aggregated, meaning that we take data from multiple sources, multiple forms of measurements, we compile it, and we summarize it. So we're halfway through the 22-23 funding year. Let's take a look at some outcomes so far, organized by our impact areas. You can go to the next slide, Michael. So in our Cradle to Career area, which again is helping children and families on to be set up for success so that the next generation has all the tools and skills they need from birth to having their own work and career. We invest in 18 different programs and initiatives, including Raising a Reader and Thriving at 3. We serve those programs at the 6-month mark have served over 3,200 people. Of those 3,200 people, over 2,100 of them are in poverty. So what does this mean? We ask all of our programs to report on everyone they serve in the program. Then we ask them to tell us, okay, of the numbers you're serving, how many of those people are at or below the federal poverty line? And in this case, they have reported to us that they can verify that they've documented that 2,100 people are at that income level. So why the gap? Well, the reality is in Health and Human Services, programs serve people oftentimes regardless of their income, or they serve a lot of low income people, or they serve people whose income they don't know. So we don't always know the income level of everyone, but because we are focused on ending generational poverty, we are able to at least subset out how many are in poverty. And today we're going to share outcomes for people who are in poverty. We collect all the outcomes, but today we're sharing these. So in our Cradle to Career area, we know that 46 babies had healthy birth outcomes. Why do we track that? Because it all starts with maternal health. A child to be ready for college and career needs to be born on time, term, and without any complications. And so we do fund programs that support healthy birth outcomes for mothers and babies at risk. And we know that 46 of them in poverty were born healthy. We know that parents have improved their parenting skills. How do we measure that? Parenting skills is often measured by home visiting. It's measured through evidence-based curriculum like the Nurturing Parenting program. We want parents to know how best to be the best parent that they want to be and help that child along a path to success. We also know that caregivers have improved their engagement with their children. What does that mean? What that means is that families learn how to be teachers at home. They know how to support learning at home. They know how to share books with their children. That if you're a new parent, what do you do with this book with this squirming toddler? What do you do with that? How do you do it? I know I need to read to my kid, but I don't know how to. So we know through certain programming that they understand children's needs, they understand where they are developmentally and how to support them along their path. So we know that 58 caregivers, all of them, have improved engagement with their children. An important part of the birth to eight outcome area is also reading. We want children by age 8 to be ready for school and reading on grade level. We don't really have a lot of grade level reading data right now. The school year is still happening. We'll have much more robust information at the end of the fiscal year. And so that's just, the reality of academics. They're still in school, right? So we need to go back one slide. There we go. Cradle to career, our children and youth outcomes. So once children are older, over the age of 8, we want those children to be then set up on that path to being ready for success in school, work, and life. And we focus on those programs with academic success, college readiness, work readiness, and social emotional learning. A really important indicator for that is school attendance. We know that 217 children and youth who've had attendance issues have improved or maintained their attendance. You don't learn when you're not in school. And so removing those barriers to being able to go to school is huge. And so with 65% of those children attending, that's a win. We also know that we need to measure their grades. So we have children in middle and high school who are passing their core subjects. This will help them get on the path to graduating high school on time. Again, we don't have a lot of academic information yet. We certainly don't have transitions to the next grade level, promotions. We don't have graduation rates yet. We'll have that as the school year comes to a draw. But it's encouraging to know that children are in school, staying in school, and doing better in their classes. And then for social emotional learning, this is a really important part of schoolwork and lifelong success, particularly with COVID and all of the challenges that children have faced, not being in school in person and not having the opportunity to develop socially and emotionally. There's a lot of important work to be done there. And it's very exciting to see that 96% of the children in poverty that we have data for have improved in their soft skills, positive behavior, and life skills. How do we measure that? That is measured in a variety of ways, usually through parent observation, teacher observation, discipline records, and evidence-based assessment tools, such as the Botfin Life Skills Assessment. And then we want children and youth to be exploring careers as well. And we have 50 youth who've completed a career exploration and development program. They've learned about STEM careers, they've done interest and skills assessments, and have begun the important work of thinking about what's next for me, where will this take me? And having that done in addition to academic work is really important. So we're excited about that. For employment and financial stability, we invest in 12 different programs. Over 3,300 people have participated in those 12 programs, and our programs can verify that over 1,800 of them are living at or below that federal poverty line. And to support adults on that pathway to employment, the first thing that our programs have to do is provide some basic job skills training. And we know that 609 people have completed that training. What do we include when we say job skills training? We mean interest and skills assessment. We mean soft and technical skills, skills needed to be successful in a workplace. Basic skills such as reading, literacy, and high school equivalency. People are completing resumes. They're completing mock interview training. They are ready to start looking for a job. We also support programs that help people get job-relevant licenses, certificates, or degrees. And we have 70 people in poverty who now have better employment options because they have completed certifications, such as quick career certifications at Guilford Tech, digital literacy certifications, and early childhood eligibility in order to work in an early childhood setting. We know that 315 people have gained a new job as a result of the services they've participated in. And these are jobs with the potential for advancement. These are folks who maybe have been out of work for a long time, did not have the correct skills needed for the employment they wanted, and 315 people getting that new employment is excellent. And then barriers to employment, however, can include childcare. We do support a childcare scholarship program. 98 households in the first 6 months have used childcare scholarships to work or attend school. There are vouchers available through the Department of Social Services. There's an enormous wait list. We do have these scholarships available for people who are on that wait list. Also, what's great is that our childcare scholarships are really a 2-generation approach. This is making sure that the adults in the home can work or attend school and training while the child is getting high quality early care and education or after school care. Both those things need to happen. So we're very excited to have that support as well. And then once people are employed and have income, we can go to the next slide about financial stability. We want people to maintain their progress. When we want households to safeguard their income and grow assets. So I think we need to move 2 more slides ahead, Michael. Yeah, there we go, perfect. So we do know that 65 people have grown their savings accounts or have obtained assets. And the way they've done that is by resolving debt issues so that they can start saving or improving their credit score. We have 372 people who've increased their disposable income by accessing benefits or reducing costs. This is really important. This is about learning how to budget. This is learning about how to save on utilities through critical home repairs. This is about accessing benefits such as SNAP, Social Security, and Medicaid. It's difficult to access benefits that people are entitled to, but they are critical for helping people along the path to financial stability. And so we're excited that 372 people now have higher incomes because and more disposable income because they're able to get help along the way. So for our next slide, our basic needs in healthcare, we know that people in poverty need foundational support. So we are still committed to funding programs in basic needs and access to healthcare. We have 19 programs that receive United Way support in this area. Over 12,000 people participate in these programs. They participate at different levels. Those programs can verify that there's over 6,400 people at or below the federal poverty level. That is a big gap in knowing income. In this case, there are many people who have incomes over the poverty line who still need basic needs support and help accessing healthcare. There's also a number of situations for some programs, particularly that deal with personal safety, where income is not something that's tracked. The situation is a crisis situation and the support is provided. So if we want to look at numbers of who's received services, we know that 468 people in poverty received temporary shelter or transitional housing. 370 people maintained housing. And how do we help people maintain housing? That can happen through assisting with evictions, preventing foreclosure, providing emergency rental help, providing housing counseling, supportive services, or home repairs. We want people to stay in their homes, right? We want to keep them out of temporary transitional shelter if we can. So that's an important data point. 415 people are safe from a violent situation, and over 1,600 people in poverty accessed and utilized healthcare. That can include physical healthcare, such as preventive health services, case management, coordination of care. It also includes mental health and behavioral health, which we know right now is desperately needed. And then lastly, over 2,500 people accessed healthy food through United Way programs. So we're very excited that we're still able and willing to continue to fund these kinds of efforts. How do we know what the current needs in our community are? In addition to our overall strategy, we support United Way of North Carolina's local implementation of 211. And this is a great resource for helping us understand what does the landscape of need look like in our community. As a reminder, 211 is a hotline and online portal 24/7. It connects people to services with a simple phone call or online search. How have people used 211 in the last 6 months? You can go to nc211counts.org. Anyone can go there and put in zip codes, cities, counties, the whole state to see what are the real-time requests. What I did on this screenshot is I put in 5 zip codes of the highest concentration of poverty in Greensboro: 01, 05, 06, 03, and 07. And what it does, and I put in the time frame, the last 6 months, and you can see that almost half of the requests to 211 have been around housing. When you hover over the housing, it breaks out for you the kind of housing requests that people had: shelter, rent assistance, and then low-cost housing, people who need to find more affordable options and are turning to 211 for help. So 211 makes those referrals based on what people call, and many people call with multiple requests. So we're grateful to 211 for the resource coordination that they provide, directing people to the right places in our community. So please go to 211 if you need help, if you want to refer someone to help, or if you want to have a better understanding of what the needs in our community are. So I want to thank you again for your ongoing partnership and support. These outcomes are only made possible thanks to your dedication and generosity and to the expertise of the partners that we invest in. And now I'm going to hand it over to Sarah Glover, United Way's Director of Family Success Centers, and she's going to provide us a quick Family Success Center update.
Thank you, Carrie. The Family Success Centers partner with families to support their transition from poverty or into financial stability and beyond through personalized coaching and services, all offered in a central location. At these 2 centers, an adult can, for example, earn a GED and be connected to employment, and their children provided education-focused quality childcare. For the first 6 months of this fiscal year, July through December, we had 348 households listed as active, engaged in the 2 Family Success Centers. And we've been back in person for the last 6 months, and that's been very exciting because for 2 years, like many people, we were doing all virtual or outdoor services for 2 years. We expanded our coaching staff in this last spring, a year ago, and in this fiscal year are back at it, actively recruiting new members full force. We're always continuing to identify new partnerships and opportunities for our members. We're always looking for employment-focused partnerships. This year, we added a few others, for example, mental health peer support, helping people get driver's licenses, and self-confidence series. One of our good outcomes that I wanted to share is on the slide. 70% of members measured improved or maintained a stable income, not just any income, but a stable income. So thank you for giving me a moment to share these updates, and I'll hand it over to Aidan Hylamariam, Director of Guilford Success Network, for our next exciting update.
Thanks, Sarah. Guilford Success Network is our countywide mobile-friendly network that connects people and service providers to multiple supports. And these supports include an online platform and local coordinators. So the online platform facilitates connections and communications between service providers, people using the network to improve their economic outcomes, and coordinators. The coordinators help people to identify, track, and achieve their personal goals, including goals of leaving poverty. So the image on the right of this slide is a key visualization that we use in the development and the implementation of the network. So I just wanted to, let us all see what that was. We call it our journey map. And at this time, United Way of Greater Greensboro has partnered with many organizations, including 8 local service providers who are our core partners in this collaborative initiative to launch network services in 2023, so this year. Residents will be able to learn about Guilford Success Network, establish relationships with coordinators, meet with our core partners for services, and build a roadmap to establish their goals toward greater sustainable economic outcomes. Thank you again for your support. And now I'll hand it back over to Tracy, who'll give us a quick update on our community-inspired and developed BOLD goal.
Thank you, Aiden. I'm so excited about the accomplishments our strategy is making in progress and making possible at last. But certainly not least, we'd like to provide an update on our BOLD goal efforts. United Way strategy is also focused on helping communities achieve a BOLD goal to take our efforts of ending poverty to the next level. UWGG announced this BOLD goal in 2021. The goal was developed with a diverse group of over 2,000 stakeholders representing multiple backgrounds and gives our community something to rally behind. The BOLD goal, as a community united in equity and lasting solutions, 3,000 households in Greater Greensboro will leave generational poverty by 2030. I know our audience is ready to ask some questions, and between us, we'll do our best to answer them. This last slide shows you exactly where we are up to this point at mid-year.
I've been struggling. I'm like, oh, this is.
Let's take a look at the chat to see if anyone has submitted any questions, and we'll start with those. I'm not seeing any at this point. If you'd like to ask your question verbally, feel free to unmute yourself and be mindful that others may be trying to speak at the same time. So that means we must have done an excellent job and explained everything thoroughly.
So thank you, Tracy. As you can clearly see, your support is changing people's lives. Thank you again for making such significant investments into our work. Thank you again for dedicating your time, talent, and intellect to our work. I know we've said it before, but please hear us again. We simply could not do this without you. We hope that you've been inspired to continue your support. If there's anything you need or anything you want to ask, please reach out to us. We are here to serve you and this community. And before we officially close today's meeting, I want to let you know about a few upcoming events. Our young leaders, African American Leadership and Women United groups are hosting a Friends United mixer on March 23rd at 5:30 p.m. We're excited to have everyone there and look forward to seeing everybody. There's many things that are going on, and we're excited here at United Way. Also, we'd love you to attend any of these mixers in the community and to enjoy drinks and light food. We are also pleased to be Ben & Jerry's nonprofit of choice once again for their free cone day on April 3rd, 12 to 9 p.m. at Friendly Center. Please don't miss out the chance to have free ice cream while we spread awareness. And last but not least, we have a great National Volunteer Week planned for April 17th through the 21st, and we hope you can join us. Be on the lookout and follow up email that will contain more information, including how to RSVP to these exciting events. And stay tuned because the rest of 23 is full of events that will keep you up to date and inspired. Once again, as we have a lot to celebrate, but we could not have done it without you. Thank you so much for your support, and we look forward to seeing you in the future. Thank you again. Have a wonderful afternoon.